Hi, welcome to Healthy Living. We are again on location, and just like we were the other day in the hospital on the red sofa for Heart Month, we are here in our St. Tammany Physicians Network Mandeville Clinic, and we're going to talk about Heart Month again, but we're going to do it from a little different aspect. I'm here today with Dr. Kaitlin Massey.
Hi.
She is a primary care physician here at our Mandeville Clinic, and we're going to talk about heart health and how it relates to your primary care overall throughout your lifetime. So welcome, Dr. Massey.
Yeah, thanks for having me.
Thank you so much for being here. So when we talk about heart health, we talk about, your cardiologist, and we talk about getting a carotid ultrasound and, echocardiograms and all that stuff. But before you ever get there, it really does start with prevention and primary care. So can you kind of talk about that a little bit?
Yeah, absolutely. So, checking in on your cardiac health is extremely important, and your primary care doctor is a great place to start for that. When we have patients establish care with us, or we see them for regular follow-up visits or annual wellness visits, we like to talk about things like a patient's past medical history, and if a patient's been previously diagnosed with high blood pressure or diabetes, those are risk factors for cardiovascular disease. So we want to be aware of those, aware of the risk, and try to control those conditions as best we can. We also talk about things like family history, and so patients that have a family history of premature cardiovascular disease, meaning they've had a family member who's maybe had a heart attack or a stroke in their 50s, then that might put them at a genetic predisposition to cardiovascular disease. So it might warrant, different screening mechanisms, kind of closer monitoring.
Right.
And then we also talk about social history. So things like tobacco use, alcohol use, smoking and tobacco use is one of the biggest risk factors for heart attack and stroke. So we definitely address this, with our patients at primary care visits, and see if there's any way we can help the patient either cut back on use or quit altogether, whether that's things like nicotine replacement therapy or different medications. But if we can assist with that, we definitely can significantly lower a patient's risk of heart attack or stroke in the future.
Okay, and so that is something that you pretty much, it's a lot, but you cover it almost at every visit. When you come to your annual visit, you're doing all those tests, you're looking at all those numbers. And so I guess what's important for people to know is that when you do establish a relationship with your primary care physician, you have that history and that monitoring. And so how often, we say annual visits, you do recommend that, right?
Yeah, we definitely recommend, annual wellness visits. And then, some patients with certain conditions might warrant closer monitoring, like every 6-month follow-up visits or every 3-month follow-up visits. But at annual visits, we definitely do things like make sure patients up to date on regular blood work. So we screen for things like anemia, things like liver disease, kidney disease, and then specifically for cardiovascular risk and health, we screen for high cholesterol and diabetes.
Yes, and then wrapped into that, I would say, we like to say educate, screen, prevent. So part of that primary care is also educating, right? Explaining to a patient what's, like you said, the risk factor of your smoking or your drinking, and how to maybe shape that in dietary ways and also with medication.
Yeah, absolutely. So at annual wellness visits, we always talk about diet and exercise, and those prevention when it comes to cardiovascular health is extremely important. And if we can really attack those things from the forefront, we can save a lot of grief down the line. And so we talk about a heart healthy diet, which includes things like lean protein, chicken, fish, high vegetable intake, and then working on exercise as well, just physical activity. There's studies that have been shown that even 1 hour a week of physical activity can reduce cardiovascular risk.
Wow.
So obviously, more than that is better. There's a linear relationship with how much you exercise and how, the benefits on your cardiovascular health. But I like to tell my patients, who don't do any kind of activity or exercise, a good place to start is about 30 minutes 3 times a week. And that's really strenuous exercise, both cardio and resistance training. But you want to get that heart rate up and really be exerting yourself. And that's where you'll see the benefits to your cardiovascular health.
And I guess that's kind of what it means when you read something that says, check with your doctor before you start this exercise program.
Yeah.
But that is a good rule of thumb and good to know. And that's where you get that education. So if you did somehow find something that raised a red flag, and then you tested and you figured out it was a cardiovascular issue, what would be the next step as the primary care? What would you do then?
Yeah, so it just depends on exactly, what the concern would be. When we do wellness visits or follow-ups, we also do, a general review of systems. And almost every patient associates chest pain with a problem with the heart, which, is a good red flag symptom, but there's a lot of other symptoms that raise a red flag as well. So a big one is, shortness of breath, especially when you're exerting yourself, and then it improves with rest. That could be a sign that something's wrong with the heart.
Okay.
Also, palpitations or the sensation that the heart's racing could be a problem with the electrical system of the heart, so that would, warrant further workup.
Gotcha.
Swelling in the legs, inability to lie flat at night, could be a problem with the function of the heart or heart failure. So kind of depending on what the symptoms are, we may check an echocardiogram, which is an ultrasound of the heart. So that checks how well the heart is pumping the blood out.
Right.
There's obviously stress tests if patients are having some, symptoms that are concerning for blockages in the heart. And then if it's severe red flag symptoms, we definitely would refer the patient to a cardiologist for an angiogram.
Okay. Now, some of those symptoms you mentioned, people often say, "Oh, I'm just so tired. That's why I'm short of breath." Or, "Wow, that was really heavy when I moved." But you moved it last week or 2 weeks before and you didn't have a problem. So speak to dismissing symptoms, right?
Yeah.
And why you should definitely call your primary care with a concern.
Yeah, I think that's very common. A lot of people, make excuses for different symptoms or think it could be that, it could be this, that wouldn't happen to me. I couldn't have a heart attack. I couldn't have heart disease. So it's very important if you have any of these red flag symptoms to see a primary care doctor and go over with them. And it could be something that is not concerning, but then you'll have the peace of mind. And after a thorough workup, if it is that, then it's nothing to be concerned about.
Okay, good. Well, is there anything else you'd like to say just to anyone who's watching and listening about primary care, the care you give, maybe your care philosophy, and then as it relates to cardiac health that we might not have covered?
Yeah, so primary care is definitely really important. Like I said, we look at the whole picture, the whole patient, the past medical history, the family history, social history, other medical conditions that you've been previously diagnosed with to kind of assess cardiovascular risk and risk of other things. We do screening blood work, we do education, we definitely stress importance of dietary modifications, exercise, to really prevent health and prevent really other diseases as well. High blood pressure, diabetes.
Yes.
Changes to your lifestyle can make a big difference when it comes to that. So that's kind of all the things that we stress at our regular appointments.
Okay, well, good.
Yeah.
So if you would like to schedule with Dr. Massey, you can go to sttammany.health and look at our primary care page, and you can go directly to the Mandeville Clinic, and you will get the information on how to schedule with her there. But she is located here in Mandeville on St. Anne Street. We thank you so much for imparting this knowledge today and talking about heart health, because it's so important, not just in February, but all year long.
Yes,
so
absolutely.
Thank you so much.
Absolutely. Thank you for having me.
You're welcome. And thank you all for watching. That is Healthy Living for now, and we'll see you next time.